morning. My name is Mary Jo Jacobson, and I am the CEO here at San Joaquin Valley Rehabilitation Hospital. And I was asked if I could speak on a subject that is somewhat near and dear to my heart, and it is the Guillain-Barré syndrome. This is a syndrome that I saw as a clinician, and it always fascinated me. It is somewhat rare, but we see this syndrome in patients in an acute rehabilitation hospital, I would say 2 or 3 times a year at a minimum, and sometimes a little bit more. It impacts 1 in every 100,000 individuals, and the causality is interesting. It's not as well known, but we do see a link to it between having recently had some type of a respiratory or GI type viral infection. And then within days of that, the individual begins to have some unusual symptoms, typically starting with tingling, odd pains throughout, especially the legs and the back. From there, it rapidly can progress over a period of 7 to 14 days. Kind of the maximum worsening of the symptoms is up to 3 weeks. By 3 weeks, 90% of the patients with Guillain-Barré syndrome will have had the worst of all of the symptoms that they're going to have within this type of issue. So what really is it? It is considered an autoimmune disorder. For some reason, the body is attacking the myelin sheath around the motor and sensory nerves. So what exactly does that mean? If you want to take an electrical cable, for an example, you'll see multiple wires within that cable, and they have this protective coating or a sheath. Well, in the human body, the motor and sensory nerves also have something called a myelin sheath. And that myelin sheath is what is disrupted and attacked by the individual's own body for some unknown reason. And when that happens, the electrical impulses, the body's ability to carry the messages appropriately and efficiently out to the limbs, out to all the muscles that support the organs, and truly it can also impact the autonomic system, which is a whole different ball of wax, but can also impact the ability of the heart rate, your blood pressure. A multitude of things can come into this syndrome. And again, like I said, it varies from individual to individual. From a treatment standpoint, at the acute care hospital, obviously is where this patient belongs. They can progress quite quickly and have respiratory issues and can be on a ventilator for a temporary period of time. They can also have issues with swallowing. They can have issues with blood pressure, bowel and bladder. They can have issues with their eyes and their vision, chewing and swallowing, and even speaking at times. And so you can see where the acute care hospital is the right place for this individual to start with. There are 2 types of treatment that we see at the acute care hospital. One is the plasma exchange, or sometimes called plasmapheresis. And then the second is IVIG, which is immunoglobulin by IV. And both of these types of treatments seem to be successful in slowing down and beginning the reversal process. But again, lots more research is being done on this unique syndrome, and I think it continues to need to be done. What is interesting is that over time, 70% of the patients will fully recover. I do say over time because it is one of those issues that comes on rapidly but recovers a little bit slower. So you have to be patient with a situation like the Guillain-Barré syndrome. The best place, once the patient is stabilized and we know that the patient's symptoms aren't worsening, is for them to be transferred to an acute rehabilitation hospital. And this is where we have all the specialists that would work with all of those issues. We have the speech therapist, the occupational therapist, the physical therapist, the respiratory therapist, the rehab nurses, all wrapping around the various symptoms that I described earlier that this patient may end up with. And of course, teaching and training the family that the patient's support group is going to go back home to how to best manage during this time frame. Patients will stay in acute rehab anywhere from about 10 to 21 days, depending upon the severity. And by the time they go home, they have recovered to a sufficient degree that they can manage with family support, and then ongoing will need additional outpatient therapy, depending upon the issues and the individual. I just find it highly interesting because it is one of those syndromes that does recover over time, and that the unique skills of a rehabilitation hospital can truly impact the individual's success. and also that there's still so little known about it and so much more to learn. I hope you found this interesting and helpful in any way, shape, or form, and we're here to help support you getting back to better.